Gaining weight in a correct and healthy way is something absolutely normal and physiological during pregnancy. However, let's say together how much weight is too much during pregnancy. Jumping on a scale is probably the first thing that you're gonna be asked at the beginning of your pregnancy, because we want to know at the start what's your weight, and according to that kind of calibrate how much you should be gaining, how much is considered to be healthy for you. Well, this depends of course from your starting point pre-pregnancy, because if you have a healthy and correct weight during your normal life, then gaining weight during pregnancy should be something that you should not stress about if it's done in a conscious and safe way. To know exactly what you should gain, we as a healthcare professional relate a lot to something called the BMI, the body mass index. This index plots your height and your weight, and it elaborates a number, and according to this number you're plotted into different categories such as underweight, normal weight, overweight or obese. And according to that, we're able to tell you what is gonna be best for you in terms of how much kilos or pounds you should gain during your pregnancy. We know now from research and studies that what you actually eat and the kilos or pounds that you gain or not gain during your pregnancy have an impact on your baby's future life, on your baby's health, and on your baby in the future in terms of developing disease correlated with the age, such as diabetes, hypertension, or even childhood obesity, and a lot of things that we probably even don't know yet. So it's actually absolutely fascinating to understand how much you can contribute during your pregnancy, or even in the first year of life if you breastfeed by giving breast milk to your baby. It is absolutely fascinating, I was saying, how much you can impact your baby even from the start. So the first goal, if you are underweight or overweight, the first thing that you can do if you're planning to get pregnant is to actually try to have a healthy diet before you get pregnant, so that you can start your pregnancy with a normal BMI. That's actually my first one tip if you're trying to get pregnant. But don't worry, if you are pregnant and you don't fall under the normal weight category, then you just have to adjust your diet according to what is good for you during pregnancy. I've seen people even losing weight during pregnancy, but generally speaking, it's not good to lose weight. Even if you're obese, even if you're in that category, you still need to gain a few pounds to make sure that you and your baby gets what you both need. So I was saying, for a normal person, for a normal woman with an average BMI and an average weight, you should gain around 25 to 30 pounds during the course of your pregnancy. You're gonna ask me where all this weight comes from, because if you're a healthy person that is not used to see the numbers on the scale raise, you are probably thinking that 25 pounds is actually a big number for you, and you're right. But consider that the baby itself at the end of the pregnancy, a term healthy baby, is around 6 to 8 pounds only. Then you have your placenta, which is between 1 to 2 pounds. You have the amniotic fluid, which is gonna be 1 liter, at least a liter and a half, which is roughly 2-3 pounds. And then your blood volume increases as well, because your body is storing red blood cells, platelets, and generally more blood volume itself to prepare for the birth or the possible bleeding that is gonna be at birth or postpartum. You're also storing more fat that you're gonna probably see around your belly, in your thighs, and that's absolutely normal. And then you're also gonna have more breast tissues to prepare you for breastfeeding, and you might also experience at the end of the pregnancy fluid retention, when your ankle, your hands, your legs get very swollen, and that contributes into the increase of your weight. On the side, seeing that you are getting edematous or you're retaining fluids at the end of the pregnancy can be linked as well to preeclampsia. It might be a symptom related to that, but generally speaking, if you're not sure and if you think that you are getting very swollen at the end of the pregnancy, then do seek for medical attention. However, fluid retention can also be related to dehydration, because your body is trying to preserve and to store fluids. So please, once preeclampsia is excluded, then do increase your intake of fluids. We talked about what is a normal weight gain for a person with an average BMI, but what if you are underweight? Well, in that case, you should gain even more weight than a person with an average BMI. So we're talking about 28 to 40 pounds if you are underweight at the start of your pregnancy. If you're overweight, you need to be a little bit more careful of your weight gain. We're talking about 15-20 pounds. If you are obese, we're talking about 10 to 15 pounds max. But why is it so important, and why your midwife is gonna ask you about your weight gain and about what you eat at every appointment? Well, an excessive gain of weight during pregnancy exposes you more to some pregnancy related diseases such as gestational diabetes, and I can do another video on that, or hypertension, preeclampsia, DVT. On the other side, if you do not gain the right amount of kilos during pregnancy and you're underweight, that exposes you to the chance of having a preterm labor, meaning that the baby is actually delivered, that you go into labor before your 37 weeks, and these can contribute on, permanent even damage to your baby if the baby is born, especially extremely premature. So we want to avoid that. So make sure you have a specific plan in place, especially if you are below 50 kilos or if you're overweight or obese above 100 kilos, because you really need a specific plan in place in order to gain the correct amount. The weight gain during pregnancy is not distributed equally during your 3 trimesters. In fact, you're gonna see yourself gaining a few pounds, if not losing weight, in your first trimester, especially if you suffer of hyperemesis or if you have a lot of nausea and sickness in your first trimester, and also because the placenta is not fully formed and fully developed in your first 3 months, and your baby overall is actually not contributing a lot in your overall weight. In the second trimester, that's the trimester where you're gonna have a burst in energy, when you're gonna start that you can do things again, so you are gonna be more hungry for sure. You have to be careful you don't gain too much in the second trimester. A normal weight gain will be around 3 to 5 kilos, and you have to uptake your calories of 200-300 per day. In your third trimester is when your baby is gonna have all the organs completed and formed, and he or she is just gonna focus on gaining chubbiness and fat in order to be healthy at birth. So it's actually the month where you're gonna, the months actually, the last 3 months, where you're gonna see yourself gaining more weight. So make sure that if you gain a lot of weight in your first and second trimester, then you put a lot of attention in not exceeding your weight gain in your third trimester. Vice versa, if you did not gain a lot of weight in your first and second trimester, then don't think that you're out of the danger, that you still need to be very careful, because you can gain even 10-15 pounds in 2-3 months easily only. So generally speaking, you don't have to eat for 2. That's an absolutely no. Hopefully you're not gonna hear this phrase, but sometimes people can still tell you that, oh, you're pregnant, you need to eat for 2. No, you just have to increase your daily calories intake by 400 calories per day. And if you pay attention, if you know roughly what calories is in what food, you'll know that it's actually pretty easy to get 300 calories by simply having a pizza, or even a small meal can actually contribute to let you fulfill these requirements very easily. Make sure you drink a lot of water, so we're talking about at least 2 liters a day. Try to reduce the amount of caffeine you introduce into your body. Try to, if you're smoking, try to stop smoking. That's absolutely important to prevent you from having preterm labors. That's all for this video. I'm gonna link you down below some links where you can see where all these numbers are coming from. Let me know in the comments how much pounds, how much kilos you gain in this pregnancy, and I'll see you next video. Bye bye!